it's Dr. Hodges, and I am here again. I'm doing a multi-part series. I guess we can call this part 3. And we're going to discuss today calcium and vitamin D and why you need it and how you can take it. And I have known, this is Carrie Johnson. She is with Bariatric Advantage. This is not a sponsored video. However, I have used Bariatric Advantage for all of my patients. Oh my gosh. Well, I've been doing it since 2011. And it is, and we've known each other since, well, even before, like when I was in residency and all that good stuff. So, long time. These are really good vitamins. I think what also is nice about our discussion is that Carrie is a registered dietitian, and so she's able to specifically speak to a lot of the intricacies of these products. It's really important if you're a bariatric patient, or if you're in a medical weight loss program, or honestly, if you're just trying to stay healthy. Yeah. You want a good quality vitamin, and Bariatric Advantage is certainly a really good quality company. And they have wonderful products, and I recommend them to all my patients. So let's just jump right on in. Okay, so if you are a person, and I kind of say that because if you're a bariatric patient, you need 1,000 to 1,500 milligrams of calcium a day. But if you're not a bariatric patient, if you're a lady,
we still need it.
Still need 1,000 to 1,500 milligrams a day. And so, and certainly, like, I'm going through menopause right now. I certainly need to be getting that much in, because if you don't get in enough, badness can ensue. So what are some, let's talk about, we just said what you need. Now let's talk about what happens when you don't get it. So with calcium, whenever you have low calcium, the biggest thing we think about are our bones. And so I kind of think of calcium as, it's like a battery, okay? And so calcium is what is used for in your nerve impulses, for your muscles to fire. They need calcium. So it's kind of like a little battery. And the majority of the calcium in your body stored in your bones. I'd probably say like 98%. The other like 2%, which whenever you get your blood drawn, that's what's floating out in your blood. That is what your body has to keep, because your brain wants to function, your nerves need to work, your muscles need to work, so your heart can pump, so your brain can think and do what it needs to do. It has to have a very tight level of calcium to make sure that this engine is working. So for all these nerve impulses and for all these electrical pathways to work like they should. Because of that, if anything is out of whack, so if you don't have enough calcium floating out in your blood, and if you haven't gotten enough in, then your body is going to leach it from your bones. And what's unfortunate is like if your hormonal axis is off, so if you're perimenopausal or postmenopausal, all of that interferes with kind of bony reabsorption and calcium metabolism. And so that's why ladies are a little bit more prone to osteoporosis because of all these fluctuations in your hormones. So if you are a bariatric patient, because you're not absorbing as much calcium just in your daily intake, that's why you have to absorb. That's why you got to take your vitamins. You just got to do it. You got to do it. So some things that could happen, you can get osteoporosis, you can get muscle weakness, tetany, and so that's going to be like changes like with like in your muscles, in rickets. That's old school. That's like, I think of vitamin D, kind of like that, like you're all bow-legged.
Exactly.
You know, and that's from.
Remember those pictures in textbooks?
Yes, the poor little bow-legged kids, because they didn't have enough vitamin D, and that's why they wanted them all to start eating citrus. So anyway, so that is calcium. It's very important that you do your calcium. And talk about a little bit about.
I was just going to add to what you were saying, and you and I were just talking about it. You really build your bones when you're young, in your 20s up to like what, 30, 32 or so.
It's after age of 32, that all
starts to decrease, right?
Yeah.
And who's thinking about taking extra calcium when they're in college or just out of college, right? So a lot of us
No,
start off with not great bones because we didn't build our bones back when we really could be working on them. So definitely still important to get calcium in
right
now,
exactly
even more so. So that I just wanted to add that to what you were talking about with calcium. It's none of us think about it back then.
No. And one other thing that also helps to also prevent osteoporosis, since this is the big storage, is resistance training. So if like if you look at it like a chicken bone, the little ridges on the bone, well, the ridges on the bone, and they all have names. I had to learn them all in medical school. All those ridges are where the muscles will insert. And the muscle, when you flex your arm, the muscle is pulling on the bone. And at the cellular level, that causes a little bit of micro damage. And so but that's good, because if you are doing resistance training, you're now really pulling on that muscle, and that muscle is really pulling on that bone. And now that bone has to get stronger so it can keep up with the load on that muscle. And so those ridges get bigger. So if you saw my little twigs and Arnold Schwarzenegger's twig, well, I wouldn't call them a twig. Our arms would look vastly different. Our bones, his would look like a Tyrannosaurus.
Right.
You know what I mean?
Yeah.
Like a big brontosaurus thing. And like mine would be like a little chicken bone.
Tiny.
Yeah. And that's because of the resistance training,
Yeah.
So
super important.
that is also why we tell people, especially ladies that are perimenopausal and postmenopausal, if you want to decrease your risk for osteoporosis, add in resistance training.
Yep.
So you can pull on that bone, and the bone will begin to rebuild itself. So, but let's talk about, there's a couple different variations of calcium.
Yeah, and like we talked about in one of the other videos, calcium citrate is the most recommended form after bariatric surgery, just because you need acid in your stomach to absorb the calcium carbonate type, which is like we talked about, Tums.
Right.
But calcium citrate, you can take it any time of the day, not with your iron. Always want to do 2 hours apart from iron. But yeah, you don't need that acidic environment that you may not have after surgery. Right?
Exactly. So for like with calcium, it comes in two basic forms, like whenever you're getting your vitamin: calcium citrate, which is what we prefer, and calcium carbonate. When you're absorbing, we have this little trusty rusty picture. And didn't we say like our calcium, it really, when you eat your calcium, and this is your esophagus and stomach, your calcium is going to be mixing in your stomach in this acidic environment. And if you are taking calcium carbonate, you need that acid so that you can actually absorb what you're taking in. The problem is that if you've had weight loss surgery, the majority of your acid producing cells are down at the bottom of your stomach. And so if you've had a sleeve or a duodenal switch, I'm removing a large portion of your stomach. So just the sheer volume of those acid producing cells are going to go down because I've whacked them off. If you've had a gastric bypass, I'm stapling and cutting off the upper portion of your stomach. And so when the calcium comes in, it's not even mixing with much acid at all, because there's just not that many acid producing cells and the overall volume is down. So the type of cell that's in this portion of the stomach is different than down here, and you're just absorbing less. So that's why we really recommend calcium citrate over calcium carbonate, specifically for bariatric patients. But honestly, if you are a patient and if you've never had weight loss surgery, but let's say you have issues with reflux and you're taking an acid blocker, so let's say you're taking omeprazole, or Pepcid AC, or Zantac, or any Protonics, or Nexium, any of those acid blockers, you're going to be reducing the acid in your cell, the acid in your stomach. And so it's going to be harder for you to absorb calcium from the food that you eat. And so if you're going to take a calcium supplement, make sure you're doing calcium citrate. So anybody that's on any kind of acid blocker, calcium citrate, and that's whether you've had weight loss surgery or not.
Okay. And these I like because they also have vitamin D in them as well. So vitamin D helps with our calcium absorption.
Yes.
So 500 milligrams in each of these little chews it's like a Starburst consistency, right?
Oh
Is the
man,
best
they
way
taste
to-
so good.
The best
Oh my,
way to explain it.
oh my gosh. So my favorite, so in Bariatric Advantage, I think y'all have like 15 different flavors.
9, but
Oh.
it's a lot.
Okay. I'm
It
like,
feels like 15.
oh my God, they taste so good. So you can get like a bag that has like all one flavor, or they have 2 different packs. One that is chocolate, caramel, coconut, and peanut butter chocolate. And then the other one is like tropical fruit.
Yeah, so it's orange,
Strawberry.
strawberry, raspberry, and lemon.
Yes, so good. And that's one other side note. Even if you have not had weight loss surgery, let me tell you, the bariatric community, we can find something that tastes like candy. And that is what they've done.
Yeah.
Hands down, the best tasting.
Do you remember
calcium.
Viactive?
Oh,
Do you remember
no.
Viactive? The little, they're in the purple container,
Oh, yeah, yeah,
and
yeah.
it's calcium. These are so much better.
Oh, I know.
Because there's so many more flavors, and yeah.
So
But this-
much better.
That's what it reminds me of when you think about calcium and what people used to take. I remember taking those little Viactives.
Yes.
These taste
No.
so much better.
So much better. In fact, if you like a Mounds, if you have, and you need it, they're 500 milligrams each. That means you need a minimum of 2 a day. If you take a calcium and, if you take a chocolate and a coconut, it tastes just like a Mounds.
It does.
Just like a
I've
Mounds.
had someone tell me that they have taken those 2. And they actually break them in half because they're each 500, right? And it's better to space out your calcium. So you don't want to
Yeah.
take the 1,000 milligrams at one time. So I had actually a patient tell me, and I'm stealing her story, but she would take a chocolate and the coconut, like you said. She'd break them in half, and then she would twist the 2 together. So she'd still have 500, and she'd save the other half for later. But she would add a little almond on it and make it like an almond joy. And then somebody did chocolate and caramel and added a pecan to make it like the turtle candy. I mean, it's creative.
Necessity is the mother of
Exactly.
invention. It is
Exactly.
so awesome.
Yeah.
Oh, I bet
So
that
mix
is
it
so
up.
good.
I
Oh, I'm
know.
totally
Yeah.
going to try that.
Yeah.
Oh my God. Okay. They so that is calcium. And the other thing that is kind of an adjunct to calcium is vitamin D. And we call this our sunshine vitamin, but one of the main things that vitamin D does is it tells your body to absorb calcium from the food that you eat. And so if you can drink all the milk you want, but your gut really needs, calcium's a big molecule. And so vitamin D is like one of these cofactors that helps your body to absorb it. So when you're taking these guys, you really need good vitamin D, whether it's extra vitamin D, or let's say I have some multivitamins. Let's say your multivitamin already has vitamin D in it. The reason why you need vitamin D every day, it's really to help you with your calcium absorption. And the best form of vitamin D is going to be D3. What is ironic is if I give somebody a prescription for vitamin D, it's D2, it's not D3.
Oh, yeah.
So it's 50,000 I use once a week, but I will still tell patients you still need to do D3 every day. And part of the reason why people might have lower vitamin D is that vitamin D is actually converted in our skin from the sun. And so we just don't go out in the sun a whole bunch. So if you're not out in the sun a lot, or if you're always wearing your sunscreen, which you should, even if you have a lot of melanin. So I have a lot of my ladies out there that they're like, I got the melanin popping. I'm like,
You still need it.
You need your sunscreen. You got to have it. And as a side note, the more melanin that you have in your skin tone, so if you are Hispanic, if you are Asian, if you're African American, if you're not like, I almost look like I'm like blue, if you're not pasty white like me, you're going to have, just by default, if you have more melanin in your skin, you're going to have less absorption and less conversion of vitamin D in this from the sun. And so you definitely need to have more vitamin D in your diet. But the reality is that most of us work inside.
Yeah.
We're always inside.
Yeah. And too, when you're outside, you would almost have to have a swimsuit on and sit out there for several hours to really get enough
Vitamin D.
Yeah.
Yeah.
So
And then you can't do that because then you're going to get skin cancer.
Exactly.
Or like
even
me,
with our sunscreen on, where it's still not good to sit out there that long.
No. So, and it is not uncommon for me to have patients that are low in vitamin D. Like I'll get labs on patients preoperatively, and I would probably say close to half of my patients are vitamin D deficient.
I would expect so. Yeah, I've seen studies where up to 90% of bariatric patients before surgery were deficient.
Yeah.
So.
Yeah, and it's not really from diet. It's really from our lifestyle.
Yeah, exactly.
Just because we work indoors and we just don't go out a whole lot.
Yeah.
So there's that.
Well, and you mentioned the sunshine vitamin.
Yes.
Have you tried these?
Oh my God, they're so good. Can we try one?
And I think it's cool to just look at them too, because it looks like sunshine. And these are vitamin D3, 10,000 IUs. So
this is what you need. These taste so good. These are
they're like little gels,
little lemon drops. See?
Yeah,
just a
looks
little
like
lemon
little
drop.
sunshine.
Little happiness.
Okay.
Oh, they're so good. They have just like a lemon drop. It's so good.
Now, do you think, could a patient do, since this is 10,000, could they do 5 of these a week instead of a prescription?
Oh yeah, they could. Yes.
I just thought about that. You said you could do 50 a week,
a 50
right?
a week, or this. What's interesting though is what I might end up telling patients, since this is like a 1 month supply, I would either tell them that they could do 2 a day or do 1 a day and then 1 once a week, the prescription.
Oh, okay. Oh, but that's one time. The prescription's one
time a
there's
week.
50 in one. Okay, makes it easier that way.
But again, the D3 is really whenever you're looking for a vitamin that you're taking, a vitamin D, you want to make sure that you're picking D3 because it's almost like the more activated form. It's just like whenever you're picking, I mean, there's nothing wrong with D2, but it's similar to if you're using retinol for your face, what you get over the counter is not as strong as it's not the same form of what you would get like in Retin-A.
So kind of prescription dose.
Yes, and it's because the retinols that we get like over the counter, they still have to go through 1 or 2 conversion processes before, and then Retin-Now, AL, has 1 less conversion, and then you get up to Retin-A, which is like bam. But that's also much stronger, and you might not be able to tolerate that. So, but anyway, with all that being said, D3, it's where it's at. And so, and again, if you're low in vitamin D, you're going to get a lot of the same symptoms that you have if you're low in calcium, because again, vitamin D tells your body to kind of absorb more of that calcium. So,
and I will say for bariatric patients that are taking any of these vitamins that we talked about in the last video, the vitamins have 3,000 IU of vitamin D. So if they take a couple of these calcium chewy bites, they're going to get an additional 1,000 if they take 2 a day.
Because each one of these chewy bites has
500.
500. So you're going to get, when you do 2, you're going to get 1,000. Oh, okay.
Yeah. So you'll get a total of 4 between your vitamin and the chewy bite calcium.
Yeah. So you should be golden.
Yeah. And then we do have vitamin D that is 5,000 also. So if you don't need as high of a dose, you can do a smaller 5,000 tablet.
I don't tell people that. I'm like, go get this. Because it's like you're going to, and because the reality is that if my patients can do, and this is for anybody, if you can do the things you need to do 80% of the time, and then the other 20% you just live your life and see what happens, you're probably going to be okay. And so that's why I just think it's
and those just taste good.
Yes, they taste really, really good. So do your calcium, do your vitamin D. It's very, very important. And I'm going to have links for all these different products below. And take your vitamins every day.